Either we're too busy on our phones, we have this trauma that we never process, which leads us to busy ourselves to distract from actually dealing with it. And we're leaving these points of joy on the table. When you reframe the idea of joy as these experiences in life that make being a human worth being a human and living, that's different than chasing an idea of happiness.
Dr. Judith, welcome to the show.
Thank you for having me.
I am so excited to have you because I've been following your work for a little while and I've been feeling this has been a little too relatable lately. And I'm realizing that if I can relate to it, I think a lot of members of my audience probably do as well. But before we get into that, I have recently on the show been liking to talk to guests about lucky moments that they have. The show is now called She's So Lucky, where we talk about creating our own luck. So I would love to hear if you've had any little magic or lucky moments lately that you want to share.
Well, lately I've had so many lucky moments. I don't know if I would call them luck because it's a lot of hard work that led to these moments, but I remember one lucky moment that didn't seem like luck at all. It seemed like work. And it was when I was in training. And at first I felt lucky because my program director was like, come into the ER. There's a journalist here and they want to talk to young doctors who are helping children in crisis in the psychiatric emergency room. So I went in and answered all of her questions. And then when the piece came out like 2 days later, I was like, oh my gosh, I sound terrible. So I went to my director and I was like, why don't we have media training? And they were like, oh, that's a great idea. Why don't you create it? So I was like, oh, why do I have to say something? So unlucky. But I developed this course to teach myself how to talk to the press. And it turned into something amazing, incredible. I started working with these film students at NYU. And now I have this booming media career and I teach other doctors. So that was a moment in time that did not seem very lucky, but it ended up being one of the best things that I had ever done.
I love that example and also loved what you said about the work behind the luck, because that is such a big part of what we talk about on this show, where on the surface, it will seem like these serendipitous moments. And sometimes we do have serendipitous things happen that are really beautiful. But even then, to be able to seize them, there's a lot of luck and preparation behind it. And this idea that when we have lucky moments, it's often because we did a lot behind the scenes to create it. And I think that's such a great example of that.
Well, I taught those doctors today. I've been teaching this course for over 10 years now. And they were like, well, how did you do it? And I said, look back 10 years ago. You want to see my first YouTube videos? They will make you cringe because they make me cringe. Yeah, it's a lot of work.
Yeah. But also so important because I think one of the things about the internet and social media that can make it really tricky is there's so many voices out there. There's so much noise that we need qualified people in media who are also, sharing those messages. So it's really important work that you do.
Well, the qualified people don't want to do it. They're afraid of making a mistake or not being perfect. And sometimes you just got to do it afraid.
Yeah. Exactly. So I'm excited to talk to you about, your area of expertise that you are really a leading voice in, absolutely leading researcher in, and that is high functioning depression, which is something that I think a lot of us are still learning about because there hasn't been a lot of research on it outside of the work that you do. And so I want to talk about what high functioning depression is, how it may be different from what the average person, such as myself, who is not as well versed in these topics, may think of as depression, and why it's important that we understand the difference.
Yeah, so high functioning depression is not yet recognized by medical literature or coding, but it is real. Similar to how burnout wasn't in the medical coding until like 30 years ago, but we all knew it existed. High functioning depression happens when people experience symptoms of depression like low mood, problems with sleep, low energy, changes in appetite, anhedonia, which is literally, it means a lack of joy in things that once brought you joy. So all of these symptoms, but you're still functioning. And this is important because in the Bible of Psychiatry, the DSM-5, Diagnostic Statistical Manual, you'll need to meet criteria for stopping functioning or significant distress in order to meet criteria for major depressive disorder. But what if you're someone who has all of these symptoms and then you're overfunctioning? You're not breaking down. In fact, you are the rock. You are the entrepreneur. You're the working mother. You're that student who can't fail. You keep going. That's your way of coping. Then your healthcare professional says, well, there's nothing to code you with. So come back when you break down, which I thought was a broken model because when you look around and what's happening with healthcare today, there's a renaissance, right? Like we're saying, don't wait until stage 4 cancer. Let's prevent the cancer. Don't wait until you break a hip. Let's, use menopause care and let's prevent these health outcomes. In mental health, we're still in dark ages. We're still waiting for people to check that box of you're not functioning, you're in distress, and then we react. We're not proactive. So I wanted to change that because there aren't many people like me out there. The need for mental health providers and professionals, it's so high, but there's just not enough of us. So why are we waiting for people to break down? Let's give them the tools so that they don't break down. So they recognize when they need help, even though they're high functioning.
Yeah, definitely. 'Cause it seems so backwards to wait for people to get to the point of breakdown if it's preventable.
Mm-hmm.
Are there different, I guess, stages or degrees of high functioning depression that people can experience before they get to that point? And what kind of is that tipping point for a lot of people?
For the people that I work with, it's usually anhedonia.
Mhm.
So when you think of depression, people think you're in bed, you're crying, you're not doing things. But no one thinks about the flip side of depression, which is not sad, not weepy, but lacking joy. And anhedonia is that scientific term that's been around for 200 years, but no one knows about it. And many of us experience it. Many of us feel meh, blah, things don't excite us anymore. But we don't think that that's a symptom of depression. In fact, a lot of people don't know that you don't have to be sad to be depressed. By definition, you can have all those symptoms in anhedonia without being sad, and you still meet criteria for depression. But we're trained to think that depression only looks one way. I'm here to tell you that it doesn't look sad. Sometimes it just feels nothing. And if you can recognize that in yourself, then you can get the support that you need. But if no one tells you about it, then you think that's just life. But that's not life. We were built with the DNA for joy. We were built with that. That's why we have dopamine in our brains. But many of us have forgotten how to access that joy. So we end up with anhedonia.
I want to definitely talk more about anhedonia because it's something that I've been experiencing for quite some time now, and I didn't know what it was until I read your book. And it had been coming up actually a lot recently, maybe over the past month or so, where I would continuously ask people, well, what's bringing you joy? What's making you feel joyful? And I didn't have an answer. It was like, I go to therapy. My therapist would constantly be asking me, what am I doing that's bringing me joy? And I'm like, girl, I don't know. I'm not feeling it. My audience as a content creator, the number one question that everybody likes to ask is like, what's bringing you joy? Come on the podcast and talk about what's bringing you joy. And I'm like, you guys, I don't know the last time I felt it. So as I was reading your book, it felt kind of validating of, okay, now I understand why this is happening. So for those of us who are feeling that way, what are some things we can start doing to reclaim those feelings of joy?
Anhedonia can be caused by a lot of things. Many of us, if we don't process our pain and our trauma and we cope by pushing things down, not dealing with it, eventually it's hard to even feel because our go-to is, I'll deal with it later, I'll push it down, I'll process it later, but then we end up feeling nothing. But for others, it could be that we aren't accessing joy because we're so busy. And so there was a recent study that showed that adults who were on their devices with the smartphone capacity, like able to go online, able to be on socials, when you took those devices away from them for 2 weeks, it was almost as if you were treating them with an antidepressant because their joy points went up.
Wow.
And in research, when we add up happiness and we measure happiness, we're adding up points of joy. Like if you're hungry and you eat and you savor it, that's a point. Excuse me. If you're hungry and you eat and you savor it, that's a point. If you get rest or you take a nap and you feel refreshed, that's a point. If you're lonely and you connect with someone, that's a point. If you're stressed and you're able to soothe, that's a point. So all of these points of joy were being left on the table because people were on their devices. So when you removed the devices or the smartphone capacity, they could still text and call, they were able to access those points again. They were getting better rest. They were connecting with people. They were in nature. They were actually out in the world doing things because their brains were getting stimulated by joy in different ways. It wasn't just through one way on a phone. They were getting all these rich sensory input and their joy from all these different sources. And so that's why I think many of us feel meh or blah. Either we're too busy or we're on our phones or we have this trauma that we never process, which leads us to busy ourselves to distract from actually dealing with it, right? And we're leaving these points of joy on the table. And that's important when you reframe the idea of joy as these experiences in life that make being a human worth being a human and living. That's different than chasing an idea of happiness. Like when I get this job, I'll be happy. When I get that partner, I'll be happy. When I get this milestone, whatever it is, I'll be happy. The science shows us that even when we get those things, we're still unhappy. So we have to reframe it. Rather than chasing this idea of happiness, let's try to access these experiences of joy because that's how we measure happiness in science.
I love what you shared about those examples of the things that can bring us joy. If we're, feeling stressed, able to soothe, if we're feeling tired and we're able to rest, that feels a lot more attainable because I think sometimes when I at least get overwhelmed when people ask me about joy, I feel like I need to have this grand, amazing answer for people. And sometimes it feels like if I don't have an answer, it's like another metric that I'm not meeting. It's another thing on my list that I'm like, oh, I'm just not getting done because I don't have a joyful enough answer to give to people. But breaking it down into those little bite-sized pieces feels a lot more doable.
It is doable. And I'm glad you brought up stress because how many people that you know are really stressed out and joyful?
Not
None.
many. Yeah.
It's almost impossible
Yeah.
to access joy when you're so stressed. And in research, that's a point of happiness that we measure. And people used to think, well, isn't stress, anxiety, and depression? No. The brain, we know now, is so connected that we know what stress does to the brain. We know it makes it harder to access joy. When you're stressed, you're not tasting your food and saying, yummy. You're saying, let me get to what I'm doing next, right?
Yep.
So it's hard to access those basic points of joy when you're so stressed out. And that's why it's important to manage your stress. It's hard to enjoy your wins when you're always on to the next and you're checking the boxes because you're stressed. So for the high achievers that I work with, we have to celebrate our wins. We have to take a moment and honor what we've done, even if we think we're supposed to be doing it, and that's where I think people really need help. They need that guidance in that area because once you get into that mindset of going and you're a human doing, not a human being, it's really hard to slow down.
And I think what makes it so tricky is that sometimes the unhealthy behaviors that I think exhibit in like a lot of us like high functioning people are celebrated. It's almost seen as a good thing when you do all of the things and when you show up for everybody and when you're super busy and when you keep a really full plate, and it's easy to slip into a pattern of continuing to do it because it's almost seen as a good thing.
It almost feels like an addiction.
Yeah.
And not to downplay chemical addiction, but this addiction to the wins, right? A lot of notable athletes have talked about this, and they've said that after a while, it's no longer about winning, it's about not failing. And so, like chemical addiction, it's like you're not even getting pleasure from the activity anymore. You're just doing it not to feel the negative outcomes of not doing it. So like with chemical addiction, it's like you don't want to be in withdrawal because it's so physically uncomfortable and distressing. But with achievement addiction, it's like, well, I just don't want to be seen as a failure anymore. So I'm just going to keep going. I'm not even enjoying the work anymore. I just got to keep going because I can't fail, And I think when you reframe it that way, at least with my clients, they see it that way. They're like, oh my gosh, I'm not even enjoying this work anymore. And there's a close tie between behavioral addictions and anhedonia, right? A lot of anhedonia, lack of joy, is seen in addiction work. And people don't even know it. They just think, well, this is how I feel now because I'm no longer doing the thing that brought me joy. But it's because you have to rewire your brain to access joy in many different ways.
What are some ways that we can rewire our brain to do that?
Well, I think slowing down is really important. And with my high achieving clients, when they hear slow down, they think stopping. They have this all or nothing thinking like, what do you mean stop? And I'm like, I didn't say stop. I said slow down, right? And I know how that feels as someone who's a recovering people pleaser. When you slow down, you feel initially very guilty and you feel like you're lazy. But get comfortable with that feeling. It's not going to go away right away. You will have that guilt and that shame. And know that sometimes guilt and shame are trauma responses. So in PTSD research, one of the symptoms of trauma is feeling guilt, shame, low self-worth. And so many times people do things, they people please, they overperform because they feel like that's the only way they'll be worthy or lovable. So feeling comfortable slowing down and sitting in that discomfort of being lazy and challenging it and showing yourself that nothing bad happened. No one stopped loving you. No one stopped respecting you because you slowed down. That can be very powerful. So when my clients hear like, wait, doing less is powerful, yes, it is. Not just for the world, but for you to see that nothing bad happened when you treated yourself like a human being, not a human doing. So that can be, one step, a really important step. But self-validating and talking to yourself, like, why is it that I feel this way? What is it that I'm trying to outrun? And many times it's some past event that people haven't even reconciled. That's where they ended up today. They just pushed it away. They don't want to deal with it. They haven't processed it. So a lot of the work that I deal with, in my practice is trying to uncover that. And, what is it about you in that narrative that has shaped you to be who you are today? So let's try to reframe that narrative. For some, it's a childhood trauma, like, abandonment or rejection or neglect. And so this person believes that if they don't do and show up for others and they're not this role, they are not worthy. And we do a lot of challenging that inner narrative, and so, but for others, it's an adult trauma or an adult event that shaped them or impacted them. And I use the word trauma, not like the major traumas that are studied in classic PTSD work, but things that have shaped you and have shaped the way that you see yourself in the world, the way that you interact in the world. Those are significant traumas. One trauma for one individual may not even be a trauma. One event may not be a trauma for one individual, but it is for another person. So we want to tailor it to what's happening for you because there's only one you. There'll only ever be one you. So let's understand the science of your happiness. What is it about your history, your experiences that we can work on, Because I think people, they feel deflated, they feel discouraged when they're trying things and it's not working. And they're like, oh, well, it worked for my friend, didn't work for me. And then they're like, what did I do wrong? You didn't understand the science of your happiness. You didn't understand what's making you unhappy to begin with. And then we work on how to add back that joy because you're too busy chasing someone else's narrative. Take the time to understand you first.
Yeah, yeah. I'm curious if in your work, either in research or with your clients, you've also seen a like decreased or increased tolerance to maybe certain things that were once helpful. So let's say somebody is experiencing anhedonia or maybe high functioning depression, and something that was once really helpful to them was journaling. And then they reach a point where it's like they're still trying to journal in the same ways they used to, that used to be helpful, but they're not finding relief in that. Or maybe exercise was something that previously was really helpful, but isn't. How do you recommend people navigate, maybe their tools aren't working as effectively as they once were? How do they then find what works or are able to tap back into that relief?
Well, I mean, I treat a lot of clients. Everyone has a different story.
Mhm.
But when that typically happens with my clients, it usually has to do with the fact that the schedule has changed, So something that worked for them when they were in school is not working for them now that they're working in the workplace because they don't have the time for it, right? Or maybe they don't even have time for reflection the way that they used to because as a student, you're constantly reflecting and writing. But when you're working, you're not. You're delivering. And so it's not uncommon to switch up your skills over time. And it doesn't mean that journaling won't work for you down the line, but maybe at this point in time, you have to pull out different skills. That is very typical in therapy, not just for high functioning depression. And so I like to tailor it again to the science of your happiness. So what I'll do with my clients is I'll have them draw their biopsychosocials And a biopsychosocial, it sounds very complicated, but I promise you it's not. Every medical student learns it, but it's information I believe every patient can use to empower themselves. So I liken a biopsychosocial to a fingerprint. We all have a fingerprint, but all of our fingerprints are unique. So biologically in the biopsychosocial, if you imagine like 3 circles, like a Venn diagram, biologically, what are the things that medically may be draining your points of joy? So for one person, it could be that maybe they have an autoimmune condition, or for myself, I have a low thyroid, but it could be something else biologically for another person. Or what's their past medical history in their family? What are they more prone to? Are you pre-diabetic? Whatever it is for you, do you have sleep apnea? Biologically, where are you losing your joy? So psychologically, what is your past trauma or your attachment style, your resiliency or lack of resiliency factors, your IQ, and so forth. And then socially, what's happening in your day-to-day life? What's your work like? What's your school like? What's your friendships like? Your partnerships like? Your family life? The way you're eating, your movement, your diet, your access to nature, that's social. So when you look at the biopsychosocial, over time, people will have changing biopsychosocials, right? So like I mentioned, sometimes I'm working with students and then they graduate. And then something like journaling isn't as effective. Well, why? Because socially, they're in a busier environment. There's less time for, downtime reflection. Maybe they're not getting as much movement. So maybe something like exercise or movement is where we're going to target to allow them to add back points of joy versus someone who's maybe retired. And then biologically, they may be dealing with some medical issues. So how can we add supports there? Maybe they need to have a coach, a fitness coach or something like that. There's always, changes as you develop over time. We're always developing. It used to be thought that the human brain fully formed by 25, but we're learning about neuroplasticity and how the brain is changing over time until the day you die, right? So knowing that tool is so powerful, that biopsychosocial, because each person can then understand the science of their happiness in the moment and know where they're losing points of joy so they know where to target back points of joy. And let's say someone, psychologically, maybe they're dealing with emotional trauma and a bad breakup, right? So something like movement isn't going to work for them, because maybe they're too depressed or they're just too shattered emotionally and they're constantly in fight or flight from that bad breakup. So what I'll do with them is more somatic work, more, mindfulness work, or help with grounding and so forth, so they calm and they feel more regulated, right? Because right now, psychologically, that's what they need. And so that's why I hope this makes sense, that people can see, wow, there are all these avenues that I can get joy. It's not just one way. There are many things, many areas I can get joy, and where should I prioritize it at this point in my life?
Yeah, that you're able to really tailor what that support looks like for you depending on what you need.
Yeah, same tool, but different supports depending on the individual and depending on where they are in their journey.
That definitely makes sense. I know one of the challenges that I've had when it comes to my relationship with achievement and doing things that definitely have led me on the path to burnout is having this false sense of safety, feeling like I'm chasing achievement so that I can feel safe. If I make a certain amount of money, then I'll feel safe. Or if I have this accolade, then I'll feel safe. And I do think right now it's a really difficult time where there's so much just tumultuous things happening that are out of our control. Life is getting really expensive. There's so much uncertainty. And it can feel really hard to kind of manage your stress when it feels like you're kind of unsafe all the time. Do you think that there are other things that we can be doing during this moment where it feels like there's so many things stressing us out and coming at us from different directions that can help as we're navigating that?
Yes. What I ask my clients is, what is your definition of safety? What is safe for you? And many times they don't even know. It's like, what is happiness for you? They're like, oh, I think when I get this and that. And I'm like, is it truly happiness? They're like, I think that'll make me happy. I think that'll make me safe. But for communities who tend to not come from a lot of resources historically, what really makes them safe is each other, right? And there's something called the giving gap, and it's well studied in economic research, where groups of people who come from privilege and resources, they tend to not give. It's like counterintuitive, right? You would think, oh, you have all this money, you should give more. But it's the opposite. They tend to not give. And so it led people to be like, why is that? So they actually researched it. And they found, what's fascinating is they found that communities that have historically very little, they tend to give more. They give. So you, again, counterintuitive. Why would you give when you don't have? Because what they found is that when people don't come from a lot of resources, they tend to branch out and help each other, and they rely on each other during tough times. Versus communities that come from a lot, they tend to rely on themselves. So when they're in hard times, they tap into their resources and they don't reach out to others. So what I would say is that reach out to other people in your community. You will never feel unsafe. You will never feel alone. You will always feel supported when you have your people. But we often get this idea of like, oh, I've made it when I've done it on my own. You have gone strayed far from who you really are, especially when you're coming from a community that is historically underserved. We rely on each other. When you look back in time, slavery, we could not have done it without each other. Civil rights, we could not have done it without each other. Even fairly recently, Black Lives Matter, we needed each other. So I think more than ever, we have to reach out. We have to depend on each other. We should not be doing this alone.
Yeah, really leaning into that social piece of the circle that it sounds like.
And true community, not just checking a box like, I went to a woman supporting women. Like, that's not true community. Like
it's such a buzzword right now.
Yes.
Where it's like every event is labeled, every meetup is labeled community.
But it could be nothing further from the truth because half the people there are competing with each other. So you have to build the true community that you want. And then you will never feel unsafe, right? If you're feeling unsafe in your current community, that is not true community.
Woo, feeling very seen. But I do think that that's so prevalent for people right now, is just that sense of either not knowing where to get support, or even I think for a lot of people who are maybe first gens to experience something when you are like the first, and the pressure that can come with that, or to feel like, okay, I've gone further than I've seen other people go. Can people support me? How do they do that? What does that look like? You're often seen as the person who doesn't need support, which I think really relates to how we started off with the conversation. And so it's, something that I think a lot of us are navigating.
Yeah, I mean, a lot of us deal with that. I dealt with that myself, being the first college graduate, the first doctor in my family. Anybody has an ailment, it's like, call Judith. I have this on my back. I'm like, I'm not a dermatologist, So, but for me personally, I had to develop a true community of allies and people that I looked up to. And it wasn't just during college, I'm just going to have this person. I still stay in touch with my deans, the one or two Black deans that I've been in touch with. I still go to them. If I'm going through something, I'll call them up. We often forget the people that helped us. We think, oh, they're too busy. Now that I'm established, they have other people to worry about. They always want to hear from you. It's you who feels a certain way. You're projecting that out there. So the advice that I often give people who are younger in their careers, I'm like, don't forget your allies. Even if you've moved on, you've graduated, keep in touch with them. Nurture those relationships, because you will never feel alone when you have that true community. And also help others. People who've helped you, they did it for a reason. They want you to pass that on. So start to help others. Again, it's that giving gap. Even if you feel like, oh, I don't have much, there's always someone who could benefit from you. Someone who's 2-3 steps behind you who would love your support. And also that person may surpass you, and they may be the ones helping you one day. So lean back into the past and also help other people around you.
It's such a good point that I think sometimes we make up these stories about how other people feel or what other people are too busy for and don't want to hear from, when we don't know.
We don't. We assume all the time.
Yep.
And that could be from that low self-worth, that unprocessed pain. Challenge it. What's the worst thing they can say is, no, I'm busy. Even if they are busy, they'll say, well, let's meet in a month. They will make themselves available.
Yeah. Such a good point. Dr. Judith, this has been so incredibly
Mhm.
helpful. I would also love to just talk more about the book, why it was really important for you to put this resource out there for people.
Well, thank you. This was so much fun and really a pleasure. The book was really my way of, because I create content, giving people more because I would get so many DMs and phone calls to my office like, "Are you taking new patients?" "No, I'm not." And then people getting so discouraged and I'm like, "Okay, but I am writing something and I'll put it out there and, hopefully it's a tool that some people can use alongside their current therapy." But also, let's say you're waiting for 6 weeks to see a psychiatrist or for whatever how long it is where you're from to see a therapist. At least you can start understanding, you know? People take for granted something called psychoeducation. Psychoeducation is before you're actually doing the work, understanding why the work is important and what the work is. And that allows you to have less uncertainty. So the human brain doesn't like uncertainty. And so if you read about, okay, this is what trauma is, this is what depression is, that decreases the uncertainty, decreases the stress, and allows you to engage in the therapy easier versus not knowing anything about it, starting it and then being so stressed out that you're like, I don't know where to begin. And that's honestly for anything in health. If you are concerned about your heart or, your metabolics, learning about it before you're going in to see the professional is going to give you 5 steps ahead of other people who are just going and like, fix me. So psychoeducation is giving yourself the gift of knowledge and curiosity about you. Understand the science of your happiness, and then you can do the work. But many of us are just doing what we see other people doing, and we're not getting better because we don't even understand ourselves.
Mhm. No, it's so true. I had been, as I mentioned, talking to my therapist about like how I have such a hard time answering that question about joy. And so as I was reading this book, I was like, oh, Friday, I know what I'm going to go tell her because I just learned about this state of being and it describes how I'm feeling and is a really, really helpful resource.
Oh, good. I'm glad that you found it beneficial.
Definitely, definitely. Thank you so much for joining us. Can you please let people know where they can find you and continue following your work?
Yes. So you can follow me on all the socials, Dr. Judith Joseph. And my book, High Functioning, is available everywhere that books are sold. You can also get that on my website, drjudithjoseph.com.
Perfect. We'll make sure we have that linked in the show notes.
Thank you.
Thank you for being here.